101. Which of the following drugs requires frequent eye exams due to retinopathy risk? A. Hydroxychloroquine. B. Metformin. C. Amlodipine. D. Digoxin. Answer. A. Hydroxychloroquine. Rationale. Long-term use of hydroxychloroquine can cause irreversible retinopathy. 102. Which medication should be held before contrast eye procedures to prevent kidney damage? A. Metformin. B. Insulin. C. Atorvastatin. D. Furosemide. Answer. A. Metformin. Rationale. Metformin plus contrast dye can cause lactic acidosis. 103. Which of the following medications increases the risk of osteoporosis? A. Corticosteroids. B. Beta blockers. C. ACE inhibitors. D. Metformin. Answer. A. Corticosteroids. Rationale. Long-term steroid use decreases bone density. 104. Which medication is known for causing red man syndrome if infused too quickly? A. Vancomycin. B. Ceftriaxone. C. Amoxicillin. D. Azithromycin. Answer. A. Vancomycin. Rationale. Vancomycin causes histamine release, leading to flushing and hypotension. 105. Which drug is used as an antidote for benzodiazepine overdose? A. Flumazenil. B. Naloxone. C. Atropine. D. Protamine sulfate. Answer. A. Flumazenil. Rationale. Flumazenil reverses benzodiazepine-induced sedation and respiratory depression. 106. Which medication is used as the first-line treatment for anaphylaxis? A. Epinephrine. B. Diphenhydramine. C. Albuterol. D. Methylprednisolone. Answer. A. Epinephrine. Rationale. Epinephrine is the primary treatment for anaphylaxis due to its rapid vasoconstrictive and bronchodilatory effects. 107. Which medication is associated with a dry cough as a common side effect? A. Lisinopril. B. Metoprolol. C. Losartan. D. Amlodipine. Answer. A. Lisinopril. Rationale. ACE inhibitors like lisinopril inhibit bradykinin breakdown, leading to a persistent dry cough. 108. Which medication is most likely to cause lactic acidosis in diabetic patients? A. Metformin. B. Glipizide. C. Pioglitazone. D. Insulin. Answer. A. Metformin. Rationale. Metformin can impair lactic acid metabolism, increasing the risk of lactic acidosis, especially in renal impairment. 109. Which opioid side effect is most concerning for patient safety? A. Respiratory depression. B. Constipation. C. Nausea. D. Urinary retention. Answer. A. Respiratory depression. Rationale. Opioids suppress the respiratory center in the brainstem, leading to potential fatal respiratory failure. 110. Which of the following drugs can cause serotonin syndrome? A. Fluoxetine. B. Hydrochlorothiazide. C. Clonazepam. D. Losartan. Answer. A. Fluoxetine. Rationale. SSRIs like fluoxetine increase serotonin levels, and combining them with other serotonergic drugs can cause serotonin syndrome. 111. Which medication requires consistent dietary intake of vitamin K to maintain effectiveness? A. Warfarin. B. Heparin. C. Rivaroxaban. D. Clopidogrel. Answer. A. Warfarin. Rationale. Vitamin K influences warfarin's anticoagulant effects, so intake must be stable. 112. Which antihypertensive drug can cause ankle edema as a side effect? A. Amlodipine. B. Lisinopril. C. Atenolol. D. Losartan. Answer. A. Amlodipine. Rationale. Calcium channel blockers cause peripheral vasodilation, leading to fluid retention and edema. 113. Which antibiotic is contraindicated in children under 8 years old due to tooth discoloration? A. Tetracycline. B. Azithromycin. C. Amoxicillin. D. Ceftriaxone. Answer. A. Tetracycline. Rationale. Tetracyclines deposit in developing bones and teeth, causing permanent staining. 114. Which medication requires monitoring for signs of hypothyroidism? A. Amiodarone. B. Levothyroxine. C. Furosemide. D. Lisinopril. Answer: A. Amiodarone. Rationale: amiodarone contains iodine and can disrupt thyroid function, leading to hypo or hyperthyroidism. 115. Which drug is most likely to cause QT prolongation and increase the risk of torsades de pointes? A. Haloperidol. B. Furosemide. C. Metformin. D. Losartan. Answer: A. Haloperidol. Rationale: antipsychotics like haloperidol can prolong the QT interval, increasing arrhythmia risk. 116. Which medication is contraindicated in glaucoma patients due to the risk of increased intraocular pressure? A. Atropine. B. Acetazolamide. C. Timolol.
D. Pilocarpine.
Answer: A. Atropine. Rationale: anticholinergics like atropine dilate the pupils, worsening glaucoma. 117. Which antidote is used for heparin overdose? A. Protamine sulfate. B. Vitamin K, C. naloxone. D. Flumazenol. Answer: A. Protamine sulfate. Rationale: protamine sulfate neutralizes heparin, reversing its anticoagulant effect. 118. Which anti-seizure medication requires routine liver function tests? A. Valproic acid. B. Phenytoin. C. Gabapentin. D. Levetiracetam. Answer: A. Valproic acid. Rationale: valproic acid is hepatotoxic and requires liver monitoring. 119. Which diuretic can cause gynecomastia in men? A. Spironolactone. B. Furosemide. C. Hydrochlorothiazide. D. Acetazolamide. Answer: A. Spironolactone. Rationale: spironolactone has antiandrogenic effects, causing breast enlargement in men. 120. Which of the following drugs is most likely to cause Stevens-Johnson syndrome? A. Carbamazepine. B. Lisinopril. C. Metformin. D. Clopidogrel. Answer: A. Carbamazepine. Rationale: carbamazepine can cause severe skin reactions like Stevens-Johnson syndrome. 121. Which medication is most commonly associated with priapism, prolonged erection? A. Trazodone. B. Sildenafil. C. Fluoxetine. D. Clonazepam. Answer: A. Trazodone. Rationale: trazodone, an atypical antidepressant, can cause priapism. 122. Which medication should be taken on an empty stomach for best absorption? A. Levothyroxine. B. Omeprazole. C. Metformin. D. Losartan. Answer: A. Levothyroxine. Rationale: levothyroxine is best absorbed on an empty stomach. 123. Which of the following drugs requires monitoring for neurotoxicity? A. Vincristine. B. Ibuprofen. C. Metoprolol. D. Clonidine. Answer: A. Vincristine. Rationale: vincristine, a chemotherapy drug, can cause peripheral neuropathy. 124. Which medication increases the risk of osteoporosis due to calcium loss? A. Corticosteroids. B. Furosemide. C. Beta blockers. D. Acetaminophen. Answer: A. Corticosteroids. Rationale: chronic corticosteroid use depletes calcium, weakening bones. 125. Which medication is contraindicated in patients with a penicillin allergy? A. Ceftriaxone. B. Azithromycin. C. Ciprofloxacin. D. Doxycycline. Answer: A. Ceftriaxone. Rationale: cephalosporins like ceftriaxone share a beta-lactam ring with penicillin, posing a cross-reactivity risk. 126. Which of the following medications can cause tendon rupture? A. Ciprofloxacin. B. Amoxicillin. C. Doxycycline. D. Azithromycin. Answer: A. Ciprofloxacin. Rationale: fluoroquinolones like ciprofloxacin are linked to tendinitis and tendon rupture, especially in older adults. 127. Which medication requires monitoring for agranulocytosis? A. Clozapine. B. Haloperidol. C. Fluoxetine.
D. diazepam.
Answer: A. Clozapine. Rationale: clozapine can cause severe neutropenia, requiring regular WBC monitoring. 128. Which medication can cause a harmless red-orange discoloration of body fluids? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: A. Rifampin. Rationale: rifampin, an anti-TB drug, can turn urine, sweat, and tears orange. 129. Which of the following drugs is most associated with ototoxicity? A. Gentamicin. B. Vancomycin. C. Ciprofloxacin. D. Metronidazole. Answer: A. Gentamicin. Rationale: aminoglycosides like gentamicin can cause irreversible hearing loss. 130. Which medication is contraindicated in pregnancy due to fetal neural tube defects? A. Valproic acid. B. Acetaminophen. C. Insulin. D. Metformin. Answer: A. Valproic acid. Rationale: valproic acid is teratogenic and linked to spina bifida. 131. Which of the following medications is associated with photosensitivity? A. Doxycycline. B. Metformin. C. Amlodipine. D. Metoprolol. Answer: A. Doxycycline. Rationale: tetracyclines like doxycycline increase sun sensitivity, requiring sunscreen use. 132. Which medication is most likely to cause pancreatitis? A. Azathioprine. B. Metformin. C. Lisinopril. D. Loratadine. Answer: A. Azathioprine. Rationale: azathioprine, an immunosuppressant, can trigger acute pancreatitis. 133. Which drug requires therapeutic drug level monitoring to prevent toxicity? A. Digoxin. B. Lisinopril. C. Metformin. D. Ibuprofen. Answer: A. Digoxin. Rationale: digoxin has a narrow therapeutic range and can cause toxicity, leading to arrhythmias. 134. Which medication can cause gingival hyperplasia? A. Phenytoin. B. Metoprolol. C. Warfarin. D. Prednisone. Answer: A. Phenytoin. Rationale: phenytoin, an anti-epileptic, stimulates gum overgrowth. 135. Which diuretic can cause hyperkalemia? A. Spironolactone. B. Furosemide. C. Hydrochlorothiazide. D. Acetazolamide. Answer: A. Spironolactone. Rationale: spironolactone is a potassium-sparing diuretic, increasing potassium levels. 136. Which medication requires avoidance of tyramine-containing foods? A. Phenelzyne. B. Fluoxetine. C. Sertraline. D. Lorazepam. Answer: A. Phenelzyne. Rationale: MAOIs like phenelzyne can cause hypertensive crisis when combined with tyramine. 137. Which of the following is an early sign of lithium toxicity? A. Tremors. B. Bradycardia. C. Hypertension. D. Hyperglycemia. Answer: A. Tremors. Rationale: lithium toxicity manifests as fine tremors, confusion, and GI symptoms. 138. Which medication is most commonly associated with peripheral neuropathy? A. Isoniazid. B. Rifampin. C. Ethambutol. D. Pyrazinamide. Answer: A. Isoniazid. Rationale: isoniazid depletes vitamin B6, causing neuropathy. 139. Which anticoagulant is safe during pregnancy? A. Heparin. B. Warfarin. C. Rivaroxaban. D. Dabigatran. Answer: A. Heparin. Rationale: heparin does not cross the placenta, unlike warfarin, which is teratogenic. 140. Which of the following medications is associated with an increased risk of C. difficile infection? A. Clindamycin. B. Metronidazole. C. Azithromycin. D. Vancomycin. Answer: A. Clindamycin. Rationale: clindamycin disrupts gut flora, increasing C. difficile risk. 141. Which medication can cause lupus-like syndrome? A. Hydralazine. B. Metoprolol. C. Amlodipine. D. Lisinopril. Answer: A. Hydralazine. Rationale: hydralazine can trigger drug-induced lupus. 142. Which of the following drugs increases the risk of thromboembolism? A. Raloxifene. B. Metformin. C. Lisinopril. D. Atorvastatin. Answer: A. Raloxifene. Rationale: raloxifene, a SCRM, increases clotting risk. 143. Which medication can cause retinal damage with long-term use? A. Hydroxychloroquine. B. Amlodipine. C. Lisinopril. D. Metformin. Answer: A. Hydroxychloroquine. Rationale: hydroxychloroquine can cause irreversible retinal toxicity. 144. Which medication requires periodic monitoring of creatine kinase (CK) levels? A. Atorvastatin. B. Furosemide. C. Losartan. D. Lisinopril. Answer: A. Atorvastatin. Rationale: statins can cause myopathy and rhabdomyolysis. 145. Which medication is used to treat cyanide poisoning? A. Hydroxycobalamin. B. Naloxone. C. Flumazenol. D. Atropine. Answer: A. Hydroxycobalamin. Rationale: hydroxycobalamin binds cyanide, neutralizing toxicity. 146. Which of the following drugs increases the risk of hyperkalemia when combined with spironolactone? A. Losartan. B. Furosemide. C. Amlodipine. D. Metoprolol. Answer: A. Losartan. Rationale: both spironolactone and ARBs, losartan, increase potassium levels. 147. Which of the following drugs can cause a persistent dry cough? A. Lisinopril. B. Amlodipine. C. Metoprolol. D. Losartan. Answer: A. Lisinopril. Rationale: ACE inhibitors like lisinopril increase bradykinin levels, leading to a dry cough. 148. Which medication is most commonly associated with lactic acidosis? A. Metformin.
B. Insulin.
C. Glipizide. D. Pioglitazone. Answer: A. Metformin. Rationale: metformin can cause lactic acidosis, particularly in patients with kidney disease. 149. Which of the following medications should be avoided in patients with sulfa allergies? A. Trimethoprim sulfamethoxazole. B. Amoxicillin. C. Azithromycin. D. Metronidazole. Answer: A. Trimethoprim sulfamethoxazole. Rationale: sulfonamide antibiotics like TMPS-MX can cause severe allergic reactions in patients with sulfa allergies. 150. Which medication can cause Stevens-Johnson syndrome as a severe adverse reaction? A. Carbamazepine. B. Metoprolol. C. Omeprazole. D. Simvastatin. Answer: A. Carbamazepine. Rationale: carbamazepine, an anticonvulsant, can cause life-threatening skin reactions like Stevens-Johnson syndrome.